Hi, I'm Dr. Rob Silverman, Amazon bestselling author of Inside Out Health and Chief Clinical Consultant for Erchonia Lasers, Ltd. I'm excited about showing you a new way to incorporate low-level laser therapy into your practice. What I've done is that I've broken it up into what I like to refer to as the 3 phases of care. Let's go through these 3 phases and let's approach many of our conditions in or looking to diagnose which phase of care our patients are in. Number 1, phase 1, and this is phase 1 after injury. It's the acute phase. It usually encompasses the first 3 to 5 days. It's an inflammation phase. It's a very protective phase. Phase 2 is called the subacute phase, typically starting on day 4 and including and going up to anywhere from 8 weeks. It's a repair and a remodeling phase. So the structures are starting to repair and they're going to be remodeling fibroblastic proliferation to have appropriate collagen parallel lying down. And then there's phase 3, which we want to get our patients to, and it's really where we want to have our practice, a wellness, ongoing performance phase. Obviously, I skipped one phase. We should talk about it also. It's called a chronic phase. The chronic phase goes anywhere where the injury timeline is from 3 to 6 months. It's ongoing repair and remodeling, scar tissue adhesions, and fibrosis is usually present. So when you think of the 3 phases of care, I want you to take it a step further and think of what I like to refer to as the injury cycle. The injury cycle for me is based on muscle imbalances. We got strong, we have weak, we have hypertonic, we have hypotonic muscles. Typically, the patient's going to have impaired movement. Now, movement tells a story about a patient's injury. Also, posture, there'll be postural faults. Posture is the shadow of movement, so they're intertwined. The whole key is at that point, it goes to what I like to refer to as faulty motor learning. It's the chip in the brain. And I will show you that in our 3 phases of care, we'll always incorporate some sort of upregulation to the cerebellum and or proprioceptive input. Going from faulty motor learning, we're going to go to altered joint forces and that proprioception. Now, I use that term, proprioception, your sense of awareness, your balance between your nervous system and your muscular system. When those altered joint forces and proprioception is off, you're going to get joint degeneration and rubbing of the joints, which will lead you to pain, inflammation, cascading all around the injury cycle and the muscle imbalances. I like to tell all my patients that healing is a process. We all know that pain hurts without question, but sometimes after a treatment, it will ache. The change in sensation implies healing is a process. So in pre-injury, we have this beautiful, pristine tissues, muscle, ligaments, tendons, cartilage. We also have the vascular components, arteries and vein, and of course, we have no pressure to any kind of nerve. Unfortunately, you have a strained tissue, you have injured tissue, you're going to have different pressure, the starting of scar tissue, your muscles aren't going to move. You have what I call a soft piece of gum, and you may have some pressure to nerves, arteries, and veins, some hypoxia. Taking it to the next step where the patient hasn't come to you or had this surgical intervention and they have scar tissue, you're going to have healed scar tissue. Scar tissue left on the muscle after healing restricts the muscle fibers, the nerves, and vessels, causing pain and leaving the muscle less flexible. So we want to approach these type of injuries, the injuries that you see in your office, the injuries that I see in my office, in the 3 phases of care with the frequency. So we've broken it up into acute, subacute, and performance and wellness. So we have 4 for the EVRL, which is your Erchonia violet red laser. We have 4 frequencies. Each diode has 2 frequencies. We have acute 1, we have acute 2, and we have acute 3. They each have the same time limit or time suggestion, 5 minutes. So acute 1, I want you to do on day 1. Acute 2, I want you to do on day 2. And acute 3, I want you to do on day 3. You're switching the frequencies, not a huge change, but just enough because you want the patient's body to have to adapt to a new stimuli. Incidentally, frequency is the amount of times that the laser beam hits the skin per second. You get billions and billions of photons. So to make those subtle changes can really help with physiological outcomes. Subacute, same thing is true. Subacute 1, subacute 2, and subacute 3. Now, here's very interesting. Day 1, or in that subacute, let's say you're seeing that patient twice a week, you're going to do subacute 1 on day 1, subacute 2 on day 2, obviously, that you see them, subacute 3 on day 3, and then switch. And or you can also decrease the time and switch the frequencies during the treatment. The third one is the wellness and performance phase. Once again, you're going to have wellness and performance 1, wellness and performance 2, wellness and performance 3. There's going to be some additional settings. We're going to have a chronic setting, a nerve root setting, a brain setting, and a gut setting. So those are going to be the ones that you're going to start with. So that's 13 settings to start. Try and look at all the musculoskeletal conditions in a 3 phases of care when you start with your typical handheld EVRL, Erchonia violet red laser. I also shared some frequencies with the FX635 and the FX405. They're broken up very similarly in acute 1, subacute 1, wellness and performance, chronic, nerve, root, brain, and gut once again. Now, here's the difference. There's 4 frequencies for the EVRL because there's 2 frequencies per diode, whereas the FX635 has 3 diodes. It also circulates in this kind of manner. In that, you'll have and use 6 different frequencies, whereas the 405 has an additional diode, so it has 4 diodes. Now, the FX635, let me be clear, has 3 red diodes. The FX405 has 3 red diodes and 1 violet diode. The EVRL handheld has 1 red and 1 violet. So I also like to adhere to the concept of how you treat someone, and I hope to be seeing everybody, and we have several docs who do training. After you purchase your Erchonia laser, you'll get an hour training. I like to refer to how to approach and treat within the 3 phases of care as something that I like to refer to is that it's as simple as 1, 2, 3. Number 1, you want to point and shoot, static positioning of the patient and the laser. You're then going to passively move the patient. The doctor moves the patient, and the doctor also moves the laser. This is with your handheld laser. Active, at that point, the patient's going to move the limb, and the doctor also is going to move the laser. So it's as simple as 1, 2, 3. Point and shoot, passive care, and active care. And the bonus will be that you're going to laser the cerebellum for brain upregulation, what I like to refer to as laser motor locking. You will learn all these moves in your training. And lastly, now that you've purchased the Erchonia laser, I want to differentiate the lights. The red light is a 635 nanometer light. It's a modulator. It increases energy flow and dissipates energy if it's too high. It promotes increased energy through the stimulation of mitochondria. It has an anti-inflammatory effect. It enhances ATP production and protein synthesis with pain reduction. It creates an improvement in collagen fiber formation in wound healing. It also is shown to reduce pain, decrease muscle spasm, while increasing muscle strength and range of motion. It balances the parasympathetic nervous system and enhances microcirculation of blood and lymph. And lastly, it balances cell-to-cell communication. So the red light, 635 nanometer light, does a plethora of different things. The violet light has more what we like to refer to as electromagnetic transfer of energy. The laser sends photon energy, which ultimately leads to electromagnetic transfer of energy. The violet light is a 405 nanometer light. It stimulates the sympathetic nervous system. It helps body defenses eliminate bacteria, virus, fungal infections, pathogens. It works in a very short period of time. It's greater response to immune function. It also, for your musculoskeletal gurus, helps you release and heal fascial adhesions. And it is a choice wavelength for something that I'm going to share with everybody, vagus nerve stimulation. So with all that said, when you get an EVRL, you're getting the combination of the red and the violet. So you're getting them to work together. You're not canceling anything out, and you're getting something that is a standalone modality that also has a synergistic approach with any of your other treatment modalities. I look forward to training you. I'm happy you're embarking on what I like to refer as the breakthrough modality of the 21st century. It has revolutionized my practice, and it's also revolutionized my personal health care. I suffer from congenital torticollis, and about 12 years ago was looking for something to help me because cervical adjustments no longer worked with the fusion in the neck, and laser was there for me. I started with myself. I started with my friends and my family, and now I've built a practice based on low-level laser therapy, and I'm fortunate enough to be able to speak to you kind people. Any questions? Feel free to reach out. My name is Dr. Robert Silverman. Always yours in health.